Thank you, Mr. Chairman. This talk will be about accepting or rejecting kidney donors, live kidney donors with renal cyst, and I will start with situations in which we might accept donors with cysts and evidence about that. And then my dear Professor El-Fishawi will take the cons position. As we know, renal cysts are classified into 5 categories according to their appearance in CT, with category 1 or simple cyst and category 2 are not malignant and do not need any follow-up or treatment, while the other 3 categories are either potentially or actually malignant, with category 3 or 2F or follow-up needs follow-up, and the other remaining categories need surgery. I think that publications on live kidney donors with renal cysts are a bit scarce, and here are some supporting reports that started with only case report and came to sizable number of donors with cysts. All of them agreed to only take kidneys with simple grade 1 cysts that started as single unilateral cyst, and then brave attitude came into taking multiple or even bilateral cysts, leaving a kidney with a cyst for the donor. Deroofing and the pathology intraoperatively was performed in early reports, and then it's now not routine. All these reports followed up either patient or patient donor and reported on favorable outcome. In my center, the Urology and Nephrology Center at Mansoura City, Egypt, along more than 40 years, we transplanted more than 3,000 live kidney transplantations. We started to take kidneys with cysts about 2 decades after starting our program. And we have our own local policy of contraindication for living donation, either absolute or relative, and we are not brave like Professor Ibrahim, we are a bit conservative. Renal cysts are not specifically mentioned in our policy, yet it might come under the broad term urologic abnormalities, which create a lot of debate when we are confronted with donors with renal cysts. That's why we thought to collate our data, to publish and to report on it. We have 134 transplantations with kidney having cyst or more than 1 cyst. All of them were simple cysts, and none of them had family history of polycystic kidney disease, except only 2 cases where both donors were parents aging either 60 or more than 60, and they are giving to their son, and the inheritance clearly comes from the other side. What happened to our recipient after receiving a kidney with a cyst? We compared this group to follow-up matched control group of kidney transplantations. Age was comparable in both groups. However, donor age and parental donation were much higher in the cyst group, reflecting our policy of taking only donors with relative contraindications such as cyst, if the donor is more than 50 parent and the only available donor. After receiving a kidney with cyst, there was no increase in prevalence of hypertension, infection, or malignancy, and no reported urinary tract malignancy. Creatinine 1 year and 5 years after transplantation was comparable, as well as condition at last follow-up. What happened to a kidney with cyst after transplantation? Length and width paradoxically decreased after being transplanted, and these are recipient criteria. What about donor data? About 75% of our donors had only one cyst in the donated kidney. About 25 of them had 2 or more cysts of the transplanted kidney. Furthermore, about 1/4 of our donors were left with a kidney with cysts. What happened to them? 1.6% of them developed hypertension, donor after donation. And compared to our other series that followed up our donors, the results were comparable. Therefore, after publication of our report, this might be added to these 4 reports. What do guidelines say? This is KDIGO guidelines published 2 years ago about living kidney donation, and I'm very proud that Professor Muhammad Adel Bakr was one of the committee that wrote the guidelines. KDIGO group was concerned about having a kidney with a cyst, and these concerns were relative to both recipient and donor. For the donor, if we leave a kidney with a cyst to them, they might develop malignancy if this cyst is malignant or pre-malignant, and this will be catastrophic to have a kidney with malignancy and a single kidney. However, tranquilizing evidence came from this study that showed that among about 2,000 donors, none of them needed nephrectomy after donation. And therefore, KDIGO guidelines stated that a kidney with small, simple category 1 cyst can be left to the donor, particularly if there are compelling indications to accept this donor. And in most circumstances, category 2F or more should not be left to the donor. What about recipient? The concern is to receive a graft with cyst, and this cyst is pre-malignant and might develop malignancy, what's called donor-transmitted malignancy. Again, tranquilizing evidence came from Disease Transmission Advisory Committee, part of Optin, that if there are benign tumors, no significant risk of malignancy transmission, and even if there is solitary resected renal cell carcinoma less than 1 centimeter in the kidney before harvesting, before transplantation, again, risk is minimal for the recipient to develop malignancy. And based on this and other evidences, again, KDIGO guidelines stated that kidneys with simple renal cysts could be accepted to be transplanted because they are not associated with increased risk of complications, organ dysfunction, or cancer. But if the cyst is Bosniak 2 or more, this should be thoroughly investigated and decided on a case-by-case basis. More and more evidence came after publication of K-TICO to support this statement, including this latest update from Disease Transmission Advisory Committee, again, even having renal cell carcinoma in a kidney does not preclude donation of other organs in cadaveric transplantation, and even this resectable renal cell carcinoma kidney could be transplanted if it is safely resected. Coming to conclusions, Mr. Chairman, for recipient, simple cysts are accepted because this is not associated with increased risk on the recipient side. However, more than simple cysts, Bosniak 2 or more, should be thoroughly evaluated. And on donor side, kidney with small, simple category 1 cyst could be left for the donor, especially if this is the only available donor. But in most circumstances, category 2F or more should not be left for the donor. And this is Mansoura City, and this is the Urology and Nephrology Center, and this is Professor Gunaim, the founder of the center, and thank you very much.